Transcend Headache Clinic is the newest clinic in the community with a commitment to go beyond conventional headache medicine and help each individual take control of their treatment journey. Nurse co-founders Tiffany Esslinger and Kiri Severson join the show to tell us more. Welcome, ladies.
Hi. Hello.
So first off, can you start with what types of services do you provide?
Yeah, so we offer a variety of things, medication management unique to each individual, as well as Botox for chronic migraine management. And we offer nerve blocks as well as infusion therapy, with our goal with infusion is to abort migraines that maybe they haven't been able to manage at home, and with a goal to keep them out of the emergency rooms and walk-in clinics.
And so the ailments that you help treat, can you talk a little bit about that? So I'm guessing it's headaches and more.
Yeah, so there's many different types of headaches and migraines, and so what we do is help to differentiate. Are you having, just a headache, or is it migrainous, or is it cluster headache, facial pains, and then what can potentially be, is there an underlying cause from your neck or whatever it may be? So through our assessment process, we try to help to differentiate what's going on.
Yes, so many different things can happen, and it might just be that you sleep wrong or you looked the wrong way quickly or something along those lines. And so do you accept insurance? How does that all work?
Yes, so we accept most major medical insurances. There are a few that we may need to just check eligibility when you schedule that appointment. We'll make sure to check all of that before you come in for the appointment so that you don't incur any unexpected costs. And then we also have self-pay option if that's what people choose to use too.
Okay. And so is there anything someone needs to do before they come for the appointment to prepare?
No, not necessarily. I mean, you could get a referral from your primary or whoever is sending you over to us, but it's not necessarily needed. And so basically you just call and schedule, go online and schedule, and then we will send some forms to you to fill out, your medical history and stuff. But no, there's nothing special that needs to be brought. We'll take care of that at the appointment.
And why is it so important to come see a headache specialist versus just going to see your primary care physician?
Yes, so as you kind of said, specialists, we really focus on the care and learning the latest treatment options available for migraines. Definitely primary care, they can provide that service as well, or even neurology, but we've seen that there's a huge need for migraines, and getting into neurology there's usually a wait, 3, maybe 6 months, and so we're available and be able to provide that care right away.
And have you seen a lot of people needing your services since you guys have opened?
Yes, we have. And prior to opening, I mean, we were treating headaches and migraines as general neurology providers, and it's a huge need in the community, and it's definitely a huge prevalence. And so I think as we go, more and more people are going to realize it's not just a headache, and they will be seeking that care.
And where are you located?
Yes, we are located at 567 32nd Avenue East in West Fargo. So near Cashwise on Veterans and 32nd is kind of a good landmark to help find us.
And so can you give me a little bit of insight? So if I come there for an appointment and it's my first time there and I might be a little nervous going to a specialized clinic, what it would be like when I go as a patient?
So we try to keep it from feeling like you are coming to a clinic. We have a very calming atmosphere, low lighting to help with the headaches, and we're just very welcoming. We want you to feel comfortable, so we sit and we talk with you and we have that conversation. It's not just tell me what's going on, here's the treatment, out the door. And so we really want patients to feel involved in their care as well as feel welcome and a part of their treatment team, because if you're not comfortable with the treatment, we're not going to be successful in treating your migraines.
And speaking of success, that's so important when it comes to migraines and headaches. Can you talk about the success that you've seen in some of the patients you've helped?
Yeah, so again, we try and personalize our care to every individual, because maybe one medication doesn't work the same for each individual. So we come down trying to figure out that which care is best, and there's a lot of new treatments out that, for example, the Botox I mentioned earlier, there's different CGRP medications, so we just try and determine, and we've had a lot of luck with it.
Okay, so somebody that doesn't know what CGRP is, can you explain that?
Yeah, so it's a protein that we find that is most prevalent in migraine patients, and so that the medications that we have actually work to block that protein and help either prevent or abort the migraine.
Oh my. So yes, it sounds like you ladies have a vast background and helping people, and really thankful that you're here and to help. And do you help all ages?
So yes, that's a good question. We actually, because we come from an adult setting, we've kind of set it to be doing 10 and older. Eventually, yes, we will progress into doing more pediatrics, but 10 and older, so most ages.
Okay. Well, thank you ladies so much for all that you do.
Thank you very
Thank you.
much.
All right, coming up on North Dakota Today, so much more. We're going to be hearing from Hope Inc. right after the break.